It's 3 a.m. You're awake again, making that quiet walk to the bathroom for the second or maybe third time tonight. Your partner is sleeping peacefully beside you. And as you stand there in the dark, half awake, frustrated, maybe even a little worried, you find yourself asking the same question millions of older adults ask every single night. Is this just what aging looks like? Must I simply endure this? I want to tell you, clearly and directly, that you have options. What you're experiencing has a name. It's called nocturia, and while it's extremely common after 60, common is not the same as normal. And what most people have never been told, not by their doctor, not by any health article they've read, is that nocturia is rarely a bladder problem. It's almost always a timing problem. A hydration timing problem, a fluid distribution problem, sometimes a hormone rhythm problem. And once you understand what's actually happening inside your body, you can begin to implement strategies that may reduce your symptoms, often without the need for medication or surgery in many cases. My name is Dr. Marcus Reeve, and approximately in the next 20 minutes, I'm going to talk about the 3 powerful, science-backed habits that can genuinely transform your nights. I will try to explain exactly what's happening inside your aging body, why standard advice often fails older adults, and what you can begin doing tonight before you even go to bed. Before I start, need to tell this. Everything I share in this video is general health education based on current medical research. It is not personalized medical advice, and it cannot replace an evaluation from your own doctor, who knows your specific history, medications, and conditions. If your nighttime symptoms are sudden, severe, or accompanied by pain, blood in your urine, fever, or significant swelling, please contact your physician promptly rather than relying on a video. Your safety always comes first. If this is the kind of honest, practical conversation you've been looking for, type yes in the comments. It helps this video reach others who are quietly losing sleep and don't know where to turn. Now, let's begin. To fix this, you have to understand it. And the first thing I want you to know is that your kidneys are not passive filters. They are dynamic, rhythmic organs that change their behavior throughout the day based on a precise hormonal signal. That signal is a hormone called antidiuretic hormone, or ADH, sometimes referred to as arginine vasopressin. In a healthy young adult, ADH rises significantly in the evening. It tells the kidneys to slow urine production overnight and concentrate whatever urine is being made. This is why a 25-year-old can sleep 8 hours straight without a bathroom trip. Their kidneys are essentially in low-power mode while they sleep. Here's what changes as we age. After 60, ADH production at night begins to decline. Research published in the Journal of Clinical Endocrinology and Metabolism has documented that older adults produce meaningfully less nighttime ADH than they did in their 30s and 40s. The result is a condition called nocturnal polyuria, which simply means your kidneys keep producing urine through the night at almost the same rate as during the day. This affects a significant percentage of older adults with nocturia, and it's the underlying reason so many people wake up 2, 3, or 4 times even though they haven't had anything to drink in hours. This is not a disease. This is biology. But it is biology you can work with, not against. There's a second factor, and this one surprises almost every patient I explain it to. It's called fluid redistribution, and it's one of the most underappreciated mechanisms in nocturia. Throughout the day, if you eat a moderate or high-sodium diet, which the average adult absolutely does, a small amount of fluid gradually accumulates in the tissues of your lower legs and ankles. This is called peripheral edema. It can be so subtle you don't even notice it, though many older adults see faint sock marks at the end of the day, which is one quiet sign of it. When you lie down flat at night, gravity no longer holds that fluid in your legs. It redistributes upward, re-enters your bloodstream, passes through your kidneys, and ends up in your bladder. This is why so many people feel completely fine going to bed, only to be wide awake and rushing to the bathroom 90 minutes later. It isn't something you drank too late. It's fluid that was already in your body, sitting in your legs all day, finally returning to circulation. And here's the part that ties everything together. Both of these mechanisms, the ADH decline and the fluid redistribution, become more pronounced after 60. The blood vessels in your legs become slightly less elastic. The natural thirst signal weakens, so many older adults are mildly underhydrated during the day without realizing it. And then in the evening, when they finally feel thirsty, they drink more right before bed, which is the worst possible timing for an aging system. This combination, more than any other factor, is what's keeping you up at night. Before we get to the solutions, I want to gently address some of the most common mistakes I see older adults make, often with the best intentions. None of these are failures. They're patterns built from advice that was never tailored to an aging body. The first mistake is drastically cutting back on water during the day to avoid nighttime trips. This feels logical. Less water in, less urine out. But it backfires badly. When you're underhydrated through the day, your urine becomes highly concentrated. That concentrated urine can irritate the bladder lining, sending false urgency signals even when your bladder isn't full. And when you finally drink something in the evening to ease that built-up thirst, your kidneys, now in conservation mode, often process it all at once, frequently while you're trying to sleep. The second mistake is the bedtime glass of water. For decades, older adults have been told to drink a full glass of water before bed to protect the heart and prevent nighttime strokes. The intention behind that advice is sincere, but for many adults over 65, it's poorly timed. A full glass of water within 90 minutes of lying down, combined with the fluid that's about to redistribute from your legs, is essentially programming your kidneys to wake you up at 1 a.m. The solution isn't to skip evening hydration entirely. It's to take small sips if you're thirsty, not full glasses. The third mistake is the evening healthy drinks ritual. I've had so many patients who came in convinced they had a serious bladder condition because they were waking 3 or 4 times every night. When we tracked their habits, the culprit wasn't disease. It was their carefully cultivated nighttime routine. A cup of herbal tea after dinner. A glass of sparkling water to stay hydrated. A slice of lemon in their evening water for flavor. Each of these, well-intentioned, was quietly irritating an aging bladder. The protective mucus lining inside the bladder thins gradually with age. This means the older bladder becomes more sensitive to chemical irritants. Citric acid found in lemons, oranges, and other citrus fruits is a recognized bladder irritant. Carbonation increases pressure inside the bladder. Certain herbal teas, particularly those with hibiscus or high vitamin C content, can trigger urgency in a sensitive bladder. None of these would bother a 30-year-old. They can absolutely disrupt sleep in someone over 65. Alcohol before bed can affect nighttime urination. While a glass of wine can be relaxing, it also acts as a diuretic and can suppress ADH, potentially increasing urine production. Timing your alcohol consumption earlier in the evening, such as with dinner, is generally preferable to consuming it within 2 hours of bedtime to mitigate its impact on sleep. If any of these patterns sound familiar, please don't feel discouraged. None of us were given a proper user manual for the aging body. These are simply patterns to gently let go of. Now, let's talk about what actually works. 3 habits ranked from foundational to genuinely life-changing. When patients implement all 3 together, the results compound in ways that no single change can match. Habit 3. Front-load your hydration. The first foundational habit is to shift the majority of your daily fluid intake to the morning and early afternoon. Your kidneys process fluid most efficiently during the active, upright, alert hours of the day, roughly from 7 a.m. to 2 p.m. During this window, your sodium regulation, your hormone signaling, and your kidney blood flow are all optimized for higher volume processing. If you drink the bulk of your daily fluids during this window, your kidneys clear it efficiently. Your bladder fills and empties normally throughout the day. And by the time evening arrives, your body has already done most of the heavy work. What remains by bedtime is genuinely minimal. A practical target most adults can work toward is consuming roughly 60 to 70% of your daily fluid intake before 2 p.m. This isn't a rigid rule. Your doctor may adjust it based on your heart, kidney, or other health conditions, especially if you take diuretics or have congestive heart failure. But as a general framework, it works beautifully. Here's how to begin tomorrow morning. Before coffee, before your phone, before anything else, drink a small glass of water. Not gulped down, just sipped slowly over the next 20 or 30 minutes while you start your day. Then aim for another 1 to 2 glasses before noon. After lunch, taper gradually. By late afternoon, shift to small amounts only. One quiet tip that helps many of my patients: drink your morning water slightly warm rather than ice cold. Warm or room temperature water is gentler on a digestive system that, after 60, typically produces less stomach acid than it once did. It's a small change, but it tends to feel better, and people stick with it longer. If you're getting value from this so far, a quick thumbs up genuinely helps this video reach others who are losing sleep tonight. No pressure, just appreciated. Habit 2. Establish a firm evening cutoff. The second habit is creating a clear, fluid cutoff window before bed. For most older adults, this means stopping meaningful fluid intake roughly 2 to 3 hours before your intended bedtime. If you go to bed at 10 p.m., that means your last real drink, more than a few small sips, should be by around 7 or 8 p.m. This gives your kidneys the time they need to do their final filtering before you lie down, so they aren't still actively producing urine while you're trying to fall asleep. This cutoff matters more after 60 than it ever did before, precisely because your ADH rhythm has weakened. Even modest evening fluid intake, 2 or 3 glasses, can tip the balance in an older body in a way that simply wouldn't have mattered when you were younger. A few practical guidelines that make this sustainable. If your mouth feels dry in the evening, small sips are fine. You aren't trying to dehydrate yourself. The goal is to avoid loading your kidneys with significant volume in the final hours before sleep. keep a small 4-ounce cup on your nightstand rather than a large water bottle. That way, even if you wake and reach for it, the volume is naturally limited. And if you take medications at bedtime, take them with just the small amount of water needed to swallow them comfortably. There's no benefit to washing them down with a full glass. This is the habit that, in my experience, transforms results more than any other single intervention. And it's the one that almost no one is told about. We talked earlier about fluid redistribution, the way fluid quietly accumulates in your legs through the day and returns to your bloodstream when you lie down. Two factors influence how much fluid pools in your legs: how much sodium is in your diet, and how long you spend sitting or standing without movement. Sodium is the bigger of the two. When you eat a high-sodium diet, your body retains extra water to balance it. That extra water ends up in your tissues, including the soft tissues of your lower legs. The more sodium, the more pooling. The more pooling, the more fluid waiting to redistribute the moment you lie down. A modest reduction in sodium can produce a meaningful reduction in nighttime urination. Research published in the field of urology, including studies from Nagasaki University in Japan, has shown that reducing daily salt intake to within recommended levels can produce significant reductions in nocturnal bathroom trips for older adults whose nocturia is linked to fluid redistribution. The current general recommendation for adults is to keep sodium below 2,300 milligrams per day, and ideally closer to 1,500 milligrams for those with high blood pressure or heart concerns. The biggest hidden sources are not the salt shaker on your table. They are bread, canned soups, deli meats, processed cheeses, frozen dinners, and most restaurant meals. Reading nutrition labels for 1 week, just 1 week, is one of the most eye-opening exercises you can do for your overall health. And here's the second part of this habit, which works beautifully alongside reduced sodium. If you spend significant time sitting in the afternoon, watching television, reading, or working at a desk, take 20 to 30 minutes before dinner to elevate your legs. A pillow under your calves on the couch or bed works perfectly. The goal is to get your legs above the level of your heart. This simple position shift allows the fluid that pooled in your legs during the day to return to circulation while you are still awake and upright. Your kidneys can then process and eliminate it before you go to bed, instead of being woken up by it at 2 a.m. For some patients, particularly those with visible swelling in the ankles by evening, this single technique produces a dramatic improvement within just a few weeks. Beyond those 3 core habits, there are a few quieter techniques that compound the results. The first is called double voiding. Right before you get into bed, sit on the toilet, fully empty your bladder, and then stay seated for another 30 to 60 seconds. Relax, breathe slowly, and gently try again. You will often be surprised how much more comes out the second time. After 60, the bladder muscle doesn't always contract as strongly as it once did, and a small amount of residual urine, sometimes only 50 to 100 milliliters, is often exactly what wakes you up at 3 a.m. For men especially, sitting rather than standing for that final nighttime visit allows the pelvic floor muscles to relax more fully, leading to more complete emptying. The second is something I think every older adult should know about. Many of the medications most commonly prescribed to people over 60, including certain diuretics, calcium channel blockers, and some antidepressants, can directly affect urine production or fluid balance. None of this means you should change or stop your medications on your own. It means you should have a clear conversation with your doctor or pharmacist. Bring your full medication list. Ask directly, could any of these be contributing to my nighttime urination? And are there alternatives or timing adjustments we could consider? Sometimes, simply taking a diuretic earlier in the day rather than later transforms someone's sleep. But these decisions belong in your physician's hands, not in mine through a video. The third is consistent, gentle movement during the day. Your circulatory system, particularly the venous return from your legs, depends on muscle contractions to push fluid back upward against gravity. The more you sit motionless for hours at a time, the more fluid accumulates. Even short walks every couple of hours, gentle stretching, or simply standing and shifting position regularly throughout the day make a measurable difference. If walking is difficult, ankle pumps while seated, lifting your toes up and pressing them down repeatedly, gently engage the same muscles. None of this requires a gym. It just requires regularity. Before we close, I want to be very clear about something. The habits I've shared today work beautifully for nocturia driven by the common mechanisms we discussed: weakened ADH rhythm, fluid redistribution, and lifestyle timing. But nocturia can occasionally be a signal of something else, and those situations deserve a doctor's attention rather than self-management. Please contact your physician if your nighttime urination is sudden in onset, if you notice blood in your urine, if you have pain or burning when urinating, if you have significant unexplained leg swelling, if you've experienced unexpected weight changes, or if you have known heart, kidney, or prostate conditions that haven't been recently evaluated. A simple visit, a urine test, and sometimes a brief ultrasound can clarify what's going on quickly. Asking is never an overreaction. The peace of mind is worth a great deal, and a clinician who knows your history can guide you in ways no video ever can. Let's try to think this. For too long, older adults have been told that waking up multiple times every night is simply part of getting older, that you should accept it, that there's nothing meaningful you can do. That message has cost people years of restful sleep, years of daytime energy, years of feeling like themselves. And it isn't true. Your body, even at 65, even at 75, even beyond, responds beautifully when you give it the right signals at the right times. You don't need a prescription to start. You don't need expensive equipment. You need 3 things: water timed well, a clear evening cutoff, and gentle attention to what's quietly happening in your legs through the day. Add to those a thoughtful look at your sodium, your medications, and your evening drinks, and you've given your body almost everything it needs to repair this on its own. If today's video gave you something useful, please share it with someone in your life who is losing sleep and quietly suffering with this. They may not have the words to ask for help. Your share might be exactly what reaches them. And if you'd like more honest, evidence-based health education made specifically for adults over 60, you're always welcome to subscribe. We're here every week. A final reminder before we wrap up. Everything we discussed today is general health education, not personalized medical advice. Your specific situation, your medications, and your full medical picture can only be evaluated properly by your own doctor. If something in this video raised a concern about your health, please bring that concern to a qualified physician. Don't self-diagnose. And don't delay care when something feels wrong. Take care of yourself. Be patient with your body. And tonight, try one small change. That's how this begins. See you in the next one.